Hi everybody. Well, it has been a very long time since I uploaded a video, and I felt like it was time to do an update because I feel like a million things have happened. Not the least of which, if you can tell by the background, I've moved. We're relocating back to our home state, and so we're in temporary quarters while we get all of that situated. But that's here nor there. That has just been one more thing to add to a tremendous amount of stress that's been going on and has been going on for the past year and a half. I think where I left off, I was talking about my trigeminal neuralgia diagnosis and the fact that I had been on several different medications, some anti-seizure medications that were not leaving me in a good place as far as the side effects. I believe in total I tried 3, and seeing my neurologist and was finally labeled failed with the medications, and was sent to a neurosurgeon to have a special MRI done to confirm the diagnosis and to see if I was a candidate for surgery. It only took a couple of days to get the results back, and the compressions were obvious. And when I mention compressions, if you're familiar at all with TN, you know what I'm talking about. But if you aren't familiar, basically what it is there are arterial lines or blood vessels that get looped or caught up and compress the trigeminal nerve. And when that happens, the nerve is kind of like an electrical line where it's protected by a protective coating, kind of like electrical plugs and wires do. And that's called the myelin sheath. And when things like an artery are pressed up against it, what happens is the blood flows through that artery and continually pulses and continually rubs against that the protective coating, the myelin sheath, and wears it out. And so you're left with what is essentially a bare wire. And that's what leads to the electrical shocks, the pain, the stabbing, the jolts, all of the adjectives that you can use to describe a trigeminal neuralgia flare, and what leads to the intense pain associated with it. And that's what my MRI showed, was evidence that there was compression on my trigeminal nerve. And so that means that the best way to handle that was surgically. So I set out to find a neurosurgeon that was well versed in the procedure, which is considered the gold standard, which is MVD, microvascular decompression. And what that is they actually go in behind your ear through a craniotomy. They open up the skull, go beside the brain. I joke that it's not so much brain surgery as it is brain adjacent surgery. And what they do is they essentially lift off the offending vessel and wrap it or kind of in between. They place with sort of like a pillow or a sling made of Teflon to keep the artery or blood vessel or whatever from coming in contact with the trigeminal nerve. So it is a big surgery. It's the most invasive of all the treatments. However, it's the one treatment that they consider nerve sparing, in which there is no destruction that just causes the nerve to stop firing those signals that are translated by the brain as pain. There are other options I could have gone with, but that would have involved destroying the nerve or causing damage to the nerve in some way. And the results are, like, best case scenario, I think in a lot of cases you get temporary relief, whereas the MVD, although it's the most invasive, gives you the greatest chance for longer term relief. And they considered me, although I'm 46 years old, they did consider me on the young side, which means the longer I've got, the better it is for me to get long-term relief and potentially not damage that nerve. If I was older, they may say, well, you don't have that much longer left. Who cares if the nerve is damaged? Because what that results in is loss of sensation to the face and can lead to a different condition, which is called anesthesia dolorosa, which is a whole other ballgame. But I'm not going to get into all that. So although I took the scenic route to get there, I'm basically leaving you at the point that we decided to have the microvascular decompression. So I set out to find a surgeon that was an expert in the field. And doing that is a lot harder than you'd think. There were a lot of surgeons that are considered neurosurgeons, that are brain surgeons, that said they could do this surgery, but when you start actually interviewing them and talking to them, if and when you can even get to that point, because that's a whole other thing in itself, actually just trying to get an appointment, to jump through about 1 million hoops, you find out that this is a surgery they may do once or twice a year. Their bread and butter are things like carpal tunnel or degenerative disc, and they're not really TN experts. There are so few of those. So I went to the Facial Pain Research Foundation website and started looking at the surgeons that are considered experts in the field. My top choice at the time, which was back in the spring of last year, was a doctor out of Johns Hopkins. And again, it was jumping through hoops to even get an appointment with him. You have to apply, basically, you have to get accepted. And after a process, I did, and flew to Johns Hopkins to meet with him. Was very impressed. He has amazing outcomes, I guess I should say, and was able to get me in for the surgery relatively quickly. But I decided that I needed to at least talk to one other surgeon, get a second opinion, make sure that surgery was the avenue that I wanted to take, and see what somebody else talked about. So, and during that process, I found a surgeon in my home state, which is Texas, and found a doctor that also came recommended. We went and met with him. He claimed to do 1,000 of these, or had about 1,000 procedures under his belt, had nothing but good outcomes, said all of the right things, reviewed my MRI, agreed that surgery was the best option for me, pretty well gave me the same spiel that the doctor at Johns Hopkins did, which led me to feel pretty comfortable that we were making the right decision. In the end, we decided to go with the surgeon in Texas for the main reason being I felt equally as comfortable with him, and we have friends and family in Texas, which could help put us up because it's kind of a long recovery. We wouldn't be stuck in a hotel in Baltimore where we would have to pay for hotel and parking and food every single day, and just trying to get around a city where we really didn't know anybody. So to go ahead and go to Texas, where we had plenty of friends and family and would be able to have help, seemed like it made the most sense. So ultimately, that's what we decided. And in June of last year, I checked into the hospital to have my MVD surgery. Surgery lasted about 3 hours. When I woke up, I was in ICU, which is normal. I woke up in ICU in quite a bit of pain, very nauseous, couldn't see. My vision was the blurriest it's ever been in my life. My balance, equilibrium was off completely. I had a catheter. It was just, it felt like I was living in a nightmare. But I just had brain surgery, so I thought, well, this is what you have to deal with. It will get better in time. I remember having my cell phone there and hearing my cell phone go off because people were texting and calling to see how I was doing, and I couldn't read anything on my phone. I finally just had to give it to my husband, turn it off, and say, it's not even worth having it here, because I couldn't see anything. I think I tried to send a few text messages, which If you have one of those, they're basically collector's items because I was a little nutty. Anyway, after, I'm going to try to make a long story short, which I'm already failing at, but my catheter was left in for 5 days, even though every single day I begged to have it out because I was ambulatory. I was able to get up and walk with assistance with a walker, at least get up and move to a chair. They kept passing that off and saying, well, we don't have an order for it, or the night shift is going to do it. Then the night shift would come on and say we have to wait for an order, and the day shift is going to do it. Mind you, in this time, I had my surgery, I believe, on a Tuesday. My surgeon had his partner visit me briefly on Wednesday, and then I did not see another doctor from that practice for the next 5 days that I was in the hospital. Nobody, no neurosurgeon at all came to see me. The only doctor that saw me was the in-house physician that just saw me for routine labs and wasn't a specialist in the brain whatsoever. So that kind of left me with a bad taste in my mouth. And then I find out that the doctor called my husband from the operating room at the end and said things went well, she's doing fine, she's going to go to ICU, I'll talk to you in a little while. And he never came out to talk to my husband in the waiting room following surgery, which I've never heard of in my life. I was a nurse, as you've seen in my other videos. I worked in the hospital. I've been a family member with other family members having surgery, and the surgeon always comes out and talks to the family, even if there's a bad outcome, and sits down and explain. They may not be able to spend a lot of time because their time is precious, but they usually do come out and at least say things went well. This is what happened. This is the result I'm anticipating. This is, kind of what I expect for recovery, and yada yada yada. He didn't come out of the operating room to talk to my husband at all. As a matter of fact, we never saw him again for about 4 weeks. I saw him when he walked in briefly and saw me in pre-op, and didn't see him again for 4 weeks. So in recovery, I noticed that I had some very unusual bruises on my arm that left a very strange pattern. Nobody could really explain those to me. The catheter was driving me absolutely crazy. I couldn't get any relief as far as nausea and imbalance and all those kinds of things. So I was finally discharged. My best friend is a nurse, not at that hospital, but she is an RN, came to visit me, and finally had to go to the nurse's station and demand that somebody remove my catheter, and said, if you don't do it, I will. And we finally got the catheter removed on day 5. I spent a week or so recovering in Texas, maybe 2 weeks before I came home. Let me back up 1 second. While I was in Texas, right after we left, I realized that I was discharged from the hospital with no prescriptions whatsoever, none. Nothing for pain, nothing for nausea, no steroids for the swelling that obviously happens in the brain following surgery. And I know that those are the 3 things that are routinely prescribed following MVD. I got nothing. On maybe a week or so following surgery, we moved into a hotel because we moved to my home city, getting ready to pick up our kids so that we could travel back home to our home state. I got up to try to walk to the bathroom, fell on tile floor, hit my head, and was knocked unconscious. We ended up in the emergency room the next day, to which the emergency room said, it's ridiculous that you weren't prescribed any of these medications. I probably had brain swelling. So in the ER, a separate ER from the hospital where I had my surgery, they gave me pain medication, nausea medication, and the steroid dose pack that I probably should have been on for a week. We finally ended up coming home. I just felt like I wasn't getting any better. But I'm like, well, I've never had brain surgery. I don't know what this recovery is really supposed to be like, but this is horrible. Because I'd seen so many stories about people waking up saying my pain is gone, and My vision was awful, all of these things. So around first, second week of July, I noticed that I took a gigantic step backward, huge step backward. My pain was back in incredible intensity. I had another fall, a big fall where again I hit my head. I ended up with a raging urinary tract infection, which was resistant to 2 antibiotics. I saw my primary care doctor, who said that it was a direct result of having the catheter being left in for too long. That compounded with the pain in my head, the imbalance, the nausea, the vision problems, everything. Just, I was the most miserable I've ever been in my entire life. So we decided to move up our appointment, which was supposed to be 6 to 8 weeks following surgery, and we traveled back to Texas to see him. And at around the 4-week mark, I'm like, looking for guidance, looking for some sort of help. Basically, he told me, and I am paraphrasing, basically he told me I did everything right. I don't know, whatever's going on is because of you, and the imbalance, it's probably because of medications that you're on. These are the same medications that I've been on. By this point, I was off of all pain medication, but these are the same medications that I've been on for literally years, which are nothing. I mean, I take a medication for acid reflux. I take the smallest dose of a blood pressure medication because I have an irregular heartbeat, which is very benign. It doesn't cause me any trouble. I was not having any issues with my heart at the time. I can feel it. It's something that I can feel. I was having no problem with it whatsoever. I had even reduced the amount that I was taking so that I wouldn't worry about my blood pressure dropping too low. And I took something to help me sleep at night, and wasn't even taking that all the time because I was just so tired from the surgery. So nothing had changed as far as my medications. These are medications I've been on for years, medications that millions of people are on. And he's like, well, it's got to be you. Go talk to your primary care doctor. When I brought up the when I brought up the fact that I developed this raging UTI, he said, well, your catheter was out in 2 days. I said, no, it was in for 5 days. Nope, it was in for 2 days. But I was there, and I'm telling you it was in for 5 days. Nope, the nurse's notes say that it was in for 2 days. Well, your nurses are lying. And that says a lot because I'm a nurse. So I always tend to lean on the side of what the nurses say, because the nurses usually want to cover their own ass. But in this case, whether he was assuming that that's what they said, or something was documented incorrectly, or somebody was just out and out lying, I can't say, but I know what the facts are. And my husband was there, my best friend was there, who can all vouch for the fact that it was in for 5 days, which is asinine. He basically told me that nothing had gone wrong. I got a copy of my op report, which said that the bleeding was uncontrolled on at least 2 occasions, that I was put in reverse Trendelenburg, which means the bed was, or the gurney that I was on was essentially sat with my head elevated. Trendelenburg, your head is down lower than your feet. Reverse Trendelenburg, your head is higher, because the bleeding from my head was so intense. That happened twice. This is an assumption on my part. My feeling is that maybe I wasn't strapped into the gurney correctly, and that when they moved me into reverse Trendelenburg, I slipped somehow, which led to the strange pattern of bruising that I had. But in the final notes of the op report, it said that the total blood loss was less than 100 cc's. Yet he said on 2 different occasions the blood loss was so severe that the pressure had built up, and I was bleeding so badly I had to be placed in reverse Trendelenburg. So his own op notes didn't even make sense. But in the end, he told me, I've done everything that I was supposed to do. If you're not recovering right, that's your problem, and there's no reason for you to come back here. So I spent the next several months in living hell. I mean, no life whatsoever. I was essentially bedbound, very rarely got up, didn't leave the house, didn't drive for 9 months. My vision was completely destroyed. One of the times that I was put back in the hospital for 2 days after another fall, a neurologist, not affiliated with my surgery, but a neurologist at the hospital that I was at, told me that his feeling was that my vestibular cochlear nerve was damaged during my surgery, in which case, if it was actually damaged, he said, this is your new normal. Because that's what controls your balance. It's what enables you to determine where the horizon is and be able to right yourself. It works with your ears, with all of your senses, to be able to determine where the ground is and how you can balance yourself the right way. So I'm told now that it's very possible that this damage is permanent. On top of all that, my TN pain started coming back. So not only am I dealing with all of the balance and coordination issues, all of the other symptoms that I'm having, but now my TN pain is back. So I decided to go and make an appointment with Dr. Mark Linsky at UC Irvine. If you're familiar with TN at all, I know you've heard the name. He is world-renowned. He trained under Dr. Janetta, who pioneered the MVD. He is, in my opinion and in a lot of people's opinion, the most experienced TN surgeon in the world, probably. I thought there's not a chance in hell this guy is going to see me, and he's probably so busy. And second of all, at this point, I was only 4 months post-op of my first MVD, but I knew things weren't right. So I made the appointment, saw him in October of 2018. After visiting, we flew to California. After visiting with him, he basically said, I usually don't even discuss redo MVDs until somebody's at the 6-month mark, because in total, they say that total MVD recovery is about 18 months for everything, for the nerves to completely regenerate to the point that they're going to, for all of the healing to occur, for you to feel like you are the absolute best you're going to get, is about 18 months. And here I was at 4. And at 4 months, he told me, this needs to be redone. This needs to be redone. So I scheduled the surgery for December of 2018. Luckily, insurance didn't give me any issue on that. In 2018, we flew back to California, did all of our pre-op testing. I was still having all of my balance problems, everything. Ended up having surgery, which took 7 hours. He booked the OR for 3, I believe, and it took 7. He said that my head was a mess to get in and redo all of the things that were done in my first surgery. He didn't come directly out. I don't want to put words in his mouth. He didn't come straight out and blame my first surgeon, but the fact is that a lot of the things that he was repairing were done in my first surgery, so it doesn't take a rocket scientist to put 2 and 2 together. One of the things that he did, which I was thrilled about, was he removed the titanium plate that my first surgeon had put in over my skull. I was told that there would not be a plate, that he would be using bone putty to close my skull, and in the end he used a titanium plate, which never felt right. It always felt foreign in my body. It always felt like the screws were trying to work themselves out. I could feel it. It was awful. Dr. Linsky removed that titanium plate, and when he closed, he did close with the bone putty, so the titanium plate is out of my head, which was worth it in the end for me, having the surgery repeated. Dr. Linsky came out, spent a long period of time with my husband explaining to him how the surgery went. My catheter was out by the next morning. Dr. Linsky, the staff was amazing. I was doing Linsky laps. If you know anything about him, you know that that's kind of the laps that you do around the neurosurgery ICU, and felt, even though I still felt the dizziness and the lightheadedness and all the stuff, I felt like, and felt pain, I felt like everything that I was feeling was a result of just being 24 hours post-op, not this long-term, months-long process. So I already felt the most optimistic I had felt in months. I was discharged from UC Irvine after 3 or 4 days, I can't remember exactly. We stayed in California for a total of 2 weeks, which is what he asks of his patients, to stay in 2 weeks so that you can come back in after about 14 days and have either your sutures or staples removed, and they can do a follow-up. I had 44 staples in my head because he used my original incision. You're not going to be able to see much really because my hair's grown out, but this, you can kind of see, this is how long my hair's grown out. I have a lovely scar that goes all the way back here, down and around. But I was at Target about a week post-op to be able to do Christmas shopping. I could only do things in small bursts, but I felt hopeful. I felt like, wow, I started looking forward to living again, which was the first time that had happened in months, because there was no living at all in the months prior. I saw him between 10 and 14 days. He removed his nurse practitioner or PA removed the staples. Was told I was doing great and was sent home about 2 weeks before Christmas. Was able to go back home and recover. And it's now been 7 months since that surgery, and I can say this: my TN pain is essentially gone. I'm gonna say 90% gone. I still do get occasional jabs and flares. They're not nearly at the intensity that they were, and I've been told that those could either be ghost pains or phantom pains or recovery pains. And considering what I've been through, that's small potatoes. Like I can live with that. Unfortunately, I can say that all of my balance issues have, although I was optimistic at first that they were much better, over time I've realized that they haven't improved at all. So on the whole, I'm a lot better than I was, but as far as the probable damage to my vestibular system, that's done. There is really no way of repairing that. I did see an ear specialist recently who did some testing. They blow cold air into your ear and these different things, and when it didn't make me dizzy, I got very excited, thinking, oh my gosh, this is wonderful. You know, that didn't trigger me. And I've since found out that not having the dizziness or the vertigo triggered by this condition means that your vestibular system is essentially gone. So I've actually failed those tests, and in all likelihood, the vestibular damage that I suffered is permanent, which means I don't do well on stairs. I have just recently started driving again. I can drive short distances. I don't drive at night. I don't drive if things get really busy, because I can't do the really quick head turns that can set into motion the dizziness. Stairs really do throw me for a loop. Parking in a parking lot, and then, like, say at the grocery store, and then having to walk through the parking lot, so you're in a big open space, not having anything to grab onto, is particularly dangerous for me, because I always feel like I need to reach out and grab something, so I'm pretty comfortable at home, or I'm okay when I'm out in public with other people, but being out by myself is really challenging. I have a walker and I have a cane. I'm bad about using them because vanity. And then sometimes I just feel like they're more trouble than they're worth. I just feel like they become a tripping hazard because I wasn't the most graceful person anyway, but this is just compounded the issues of already being clumsy. So luckily I have my kids that are watching out for me and continually reach out and kind of grab my hand and make sure that I'm okay. I walk like a little old lady. I do a lot of shuffling. But it is hard to come to terms with the fact that this is probably my new normal. So anyway, that's where things are right now. As far as medication, I'm not on. I have a prescription for baclofen, but I take it very seldomly. I'm not on any pain medication. I'm not on any anti-seizure medications because I really don't feel like I need to be on anything long-term for the TN. I'm optimistic that my MVD will last a few years. There kind of is an expiration date. It's not intended to be a cure. There is no cure for trigeminal neuralgia. It's intended to be a Band-Aid or a treatment. So I anticipate that at some point I'm going to have it repeated for the third time or move on to a more destructive procedure. But at this point, I am 7 months out from my redo, which was far more successful than my original one. I don't name the name of the doctor or even the practice from my first one because my intention is not to throw them under the bus, but people that ask me if I have, people that know my story, because I've been very vocal in the TN community about the things that I've been through, then if I'm specifically asked, I share. Because I cannot recommend him. I'm not out to destroy his practice. I'm not out to just spread ugliness and rumors about him. All I can do is share my story and share the facts of what happened during my surgery and the facts of what transpired in the conversations following my surgery. I know what my outcome is, and I know what having a more successful surgery yields. So I know that I walked out of surgery the first time with him in worse condition than I went into it, and it was far more successful the second time. So if you are somebody that suffers from TN and MVD is the route that you've decided to take, and I try not to talk anybody into MVD. I've always said that I'm a completely open book when it comes to my story, and I'm happy to answer absolutely any questions and share my experience with TN, but I think that it's a personal decision, and I'm not here to cheerlead and say MVD is the only way to go, because I don't think that's the case. I think that it's specific to you, and that's something that you should decide with your doctor. But if you've already decided that's the route you're going to take and you're looking for an amazing surgeon, I can't recommend Dr. Lenski enough. Again, he's at UC Irvine. Getting an appointment with him was really far more simple than I thought it was going to be. But that's kind of my update. So again, I'm 7 months post-op from my second brain surgery, and life just is not the same. So I don't think nursing is going to be something that I'm able to return to, because I just don't have the ability to walk around and not be at risk of falling over or have to stop and take a break because I get dizzy or get uncoordinated and all this other stuff. So I think my plans of going back to school and advancing my nursing education have come to an end. So that's my update. Sorry this took so long, but if you are somebody that has been diagnosed with trigeminal neuralgia, or you have symptoms that you think could be related to trigeminal neuralgia, or a family member, or any type of neuralgia surgery maybe in your future, and you want to reach out to me, I'm happy to talk to you about my experience and the things that I know. But obviously that's a decision that you have to make with your friends and family and your doctor, because nobody knows your condition and your exact situation better than you and your healthcare providers. So anyway, if you made it through all of this and you know, you're still here and still interested in listening to anything else I have to say, I truly appreciate it. Hope that you'll subscribe and stick around, and hopefully this won't be another year before I make another video. It's just been a lot this year. So anyway, thanks so much for watching. Bye.